Being able to estimate when a patient has entered the terminal phase can be useful, although often difficult to determine. Although having an estimation can be confronting for the patient and family, the news can allow them to prepare and plan for the impending loss.
So having an estimate is important because it gives them the time and space to be able to attend to their emotional needs of dying, but also attend to the practical things, whether that be the paperwork of getting wills and houses and all those things in order, or whether it be getting family in from rural areas, interstate, overseas. All those things are very important for people to have that quality of life in the dying phases, and having that estimate gives them time to prepare mentally, emotionally and physically for that.
Different diseases and conditions have different trajectories according to the patient's unique physical condition. It's common for patients to fluctuate in and out of the terminal phase for extended periods, which can be distressing for friends and family. However, there are some typical signs and symptoms that a patient may be close to the end of life. Often the patient may become drowsy and begin to slip in and out of consciousness. As the body begins to slow down, the patient may become less able to take foods or fluids and find it difficult to swallow. The patient's urine output may diminish, or the patient may become incontinent. The terminal phase can also be characterised by different breathing patterns.
Some of the common breathing patterns that we see when someone's approaching death are, it can be laboured breathing, it can be rapid breathing. Sometimes we find that as the body slows down, the secretions in the lungs can make a rattling noise. It's often known as the death rattle. In textbooks, nurses may read about that. That's basically where, because of the weakness and the deterioration of the patient, they're not able to cough or spit out any secretions that arise. And so part of our role in palliative care is to watch out for early signs of that and explain it and educate the patient's relatives that it's not a harmful or a painful thing.
Although difficult to determine, being able to estimate a patient's terminal phase is useful to everyone in the healthcare team. Symptoms of the approaching death include a fluctuating state of consciousness and the slowing down of bodily functions. The patient may also find it difficult to swallow or take food. Urine output and breathing patterns can also fluctuate.